Good afternoon. Today is Tuesday, December 8th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. The COVID-19 virus has deeply infiltrated our Oswego County community. Today, we have 544 active cases and more than 1,300 of our residents are in mandatory isolation or quarantined. Our county has had 2,356 people test positive for coronavirus since this pandemic began. Yesterday, the statewide positivity rate was 4.79%, but here in Oswego County it is 7.7%. Over the past 7 days, almost 8% of Oswego County residents who were tested for COVID had the virus. If you don't know someone who has been infected or had close contact with an infected person, you probably will soon. It is not safe for different households to get together, even if they are from the same family. This includes dinners, birthday parties, kids' sleepovers, and holiday parties. Our health department is seeing numerous clusters of cases among family members who live in different households. The infection is also spreading in adult care facilities in our county, and over the past week there have been many new exposures at area restaurants and businesses. Even though there continue to be alarming increases in our county, as of right now, the state has not placed Oswego County in a color-coded zone. Yesterday, the governor announced that if a region's hospitalization rate does not stabilize in 5 days, indoor dining restrictions will be reduced to 25% of a restaurant's capacity. We do not want that to happen. These decisions are based on metrics, and the state health department will be looking at regional hospital capacity and how much stress there is on the regional healthcare system. Oswego County is part of the Central New York region, and we're grouped with Onondaga, Cayuga, Cortland, and Madison counties. Here are some points to keep in mind about how the new restrictions could occur. In the Central New York region, hospitalizations have increased sharply in the past week. Again, in the 5-county region, the numbers of available hospital beds and available intensive care unit beds are declining steadily, especially in the past 5 or 6 days. If a region's 7-day average hospitalization growth rate shows that the region's hospitals have reached 90% of their patient capacity within the next 3 weeks, the region will become a red zone. Restaurants would only be able to provide takeout orders, and non-essential businesses would be closed again. All of this information is available on the forwardnewyork.gov website. There's also a lot of detail on the county COVID-19 dashboard. The county dashboard is updated every weekday. The dashboard displays a breakdown of the virus activity in each town and the 2 cities in our county, and other information such as the number of hospitalizations to date. Go to oswegocounty.com and follow the links. Yesterday, Dr. Fauci stated that we haven't seen the post-Thanksgiving surge yet, and that everyone should be prepared for the pandemic to keep getting worse. He predicts that things could start getting really bad in the middle of January. The CDC and public health officials at all levels are telling people to limit their holiday gatherings. But Diane is here to share some more information from the county health department's perspective. Diane?
Thank you, Chairman Weatherup. As of this afternoon, we have 87,600 COVID tests that have been performed. We have 2,356 positive test results. We have 544 active cases. We have 1,807 residents that have been released from isolation or quarantine. We have 5 deaths related to COVID-19. We have 84,822 negative test results that have been returned. And we have 1,331 residents in mandatory isolation or quarantine. I want to let everyone know that we've added staff to cover our COVID hotline so that people can call during weekdays or during weekends. The hotline is now open Monday through Friday from 8:30 to 5 p.m. and Saturday and Sunday from 9 a.m. to 1 p.m. The number to call is 315-349-3330. If you test positive for COVID-19, you will be contacted by the health department. Remember that you may get your test results before the results are transmitted to the health department. Those testing positive need to stay home and isolate from others in the household. This means separating yourself in a room that is not shared with others. Stay 6 feet away from others at all times. Use a separate bathroom if possible, and disinfect after each use. Wear a face mask if you must be around others, and wash your hands frequently. Do not have visitors to your home. Those that live in your household with you should stay home until you are contacted by the health department. It's very important that parents make sure their children are following isolation and quarantine orders as well. People in quarantine should stay home, separate themselves from others, and monitor their health for symptoms of COVID. Getting a negative test result doesn't absolve you from the responsibility to quarantine if you've been ordered to quarantine. Stay home for 14 days after your last contact with a person who has COVID-19. Keep in mind that a negative test result is only accurate for the day it is given. A person can test negative one day and test positive later on. You can still develop symptoms up to 14 days after you've been exposed. Thank you.
Thank you, Diane. I also want to thank the Fulton Lions Club and the Central New York Lions District for donating fogging equipment to disinfect county offices. The fogger will be used by the county buildings and grounds staff to spray and disinfect county buildings. We appreciate the Lions' generosity and community spirit in supporting the county's COVID-19 response measures. Again, please rely on accurate sources of information about the COVID pandemic. Wear a mask, stay at least 6 feet apart, avoid crowds, and wash your hands often. The more steps you take, the better you are protected against COVID-19. Thank you for doing your part.